Hey there, everybody. Welcome back. We are over the hump on week 5, so we're past the halfway point already. So how about that? We are really, I think, doing well in this class and moving along really nicely. This current section of factors that determine health based on social circumstances is really great. It's going great so far. I feel like your discussions are right on point, and I love how you're able to see the connections here with what we're doing related to integrative health and wellness and the social determinants of health. So yeah, let's keep going on this, and we've got a lot more in this to cover. And this week is especially, I think, important on the topics that we're covering. The 3 videos that we have lined up for this week: the Becoming American, Bad Sugar, and Place Matters, I think are really important. And I've shown these videos in other courses and programs as well, particularly in the undergrad level, because I think it helps them, students at that level too, appreciate what's going on relative to the social side of health. So I'm looking forward to seeing again what your discussions look like, and I always enjoy listening to those and reading those. I wanted to just give you a little perspective on here too, or just maybe not perspective, but just a little more information about how we've tried to develop in this realm of social determinants of health. And as you probably are aware, this is a relatively new part of healthcare, our health system, particularly related to public health. And I think over the course of the really difficulty times in the pandemic, it brought light to this more so than what it was before. Of course, it was a known thing prior to that, but not something that was necessarily talked about. And I think particularly the side of the food insecurity piece really became apparent and made a lot of headlines, and still makes a lot of headlines, and rightfully so, because that aspect of social determinants really went on another level during the pandemic. But there's all other kinds of categories and pieces that matter within that, and so that's what hopefully we can move down that road and kind of talk more about that as we keep progressing in these pieces within the course here. And so again, as I said, I think in last week's video, it's a really important part of this program that we can start making these connections between what health means and the advice and guidance that we offer people relative to eating right and exercising more and getting enough sleep and so forth, those lifestyle pieces and relationship and all of that, and connect these social factors that are really the underpinnings on success for that in many ways. So this few weeks here that we're covering is really important, from a program side, from the full master's program side. We started here. We started in advanced lifestyle medicine with looking at a lot of the social determinants piece, and then hopefully they've been somewhat threaded throughout the program as you've gone through, or at least maybe in the back of your mind with the seeds that we're planting in advanced lifestyle medicine. And now we're coming to this point at the end where we're bringing it back and making even more of an extra effort to try to understand this, given all the other information that we've studied over the last 36 hours of content that you've had. Just by way of context, when we started the lifestyle medicine program that we run for our employees, this wasn't part of the any part of the equation. Okay, so this was 15 years ago, and I think even back then, it sounds crazy to say it now, but back then it was still mostly this, okay, healthcare is about making sure you follow the orders from your physician or provider, and if you do those things, and then everything's going to be okay. And we were moving, transitioning from that mindset to say there's probably a little bit more to it than that, and we should probably be asking more questions and getting more information from patients and clients relative to the other aspects of their health. And so that transitioned into a big focus on lifestyle and wellness, and to say, well, eating is important too for managing your chronic conditions, or particularly back then, it was such a big emphasis on obesity because the prevalence was, the curve on the prevalence was so steep then. And so it was mostly this focus on food and exercise, and still not this really broader perspective of what health looks like and what factors influence the ability to be successful with going to the grocery store, or what kind of exercise do I do? Do I go to a gym? Do I do it by myself? Is something of low intensity work okay, or I need to go out, no pain, no gain kind of thing? And so there was a lot of work in that space relative to research and education, to try to inform all, not just patients and clients, but healthcare providers on what was working most effectively for particularly chronic disease. But then, okay, so this is how we started in the lifestyle medicine program. But as we got into it, and it really didn't take long at all for us to be sitting down with folks and talking about lifestyle behaviors, for these other things to start coming up, like, man, my life is really stressful because, it might be a social support thing at home. It might be a bad work environment. It might be that taking care of elderly parents, or I've got young kids at home, or both. Or it might be because, I don't have enough money. It might be because I don't, the grocery store isn't very close to me, and it doesn't really work well for me to go there several times a week to make sure I have fresh food. There's all kinds of things that kept coming up as when I would talk with folks about, okay, let's talk about all the reasons why this is difficult to be successful with eating right, exercising, losing weight, whatever we were trying to do, managing blood pressure, cholesterol, diabetes. And those are the things that actually were the main points of the conversation. And so I quickly realized that I had zero training in that. I didn't know, I could, of course, I heard it, I understood it, and certainly empathized with it, but I didn't have any type of background information about what this really meant relative to trying to move people forward in a program. And certainly on an individual basis. So that's what gave me the motivation and the clarity to say, I need more information about this. So I went back to school and got a master's in medical anthropology, so that I could really understand the social side of what was going on. And there was so much that I hadn't understood. Most of my training was in natural sciences, of course, being in exercise science world, and then the pharmacy world, and then particularly working in the healthcare setting in cardiovascular disease. So it was really almost exclusively natural sciences. I had very little social science training. I had some classes, of course, in my undergraduate years, and I think there was sprinkling of some things in what I was doing, but no formal training. And so that's why I went back and said, there's so much more I need to know about this. And it helped a lot. I have to say, it helped understand the system, and that the system is such a driver of this, meaning the healthcare system, our government, our politics, big soda, big food industries, big sugar. The major industries and institutions that are there that really drive how we move ourselves forward, in a very personal way too, that we may not even be aware of. I mean, I think most of us go about our daily business and make the decisions that we make, not knowing how influenced we are by the institutions and industries that drive our behaviors, such as when we go to the grocery store. We are already greatly influenced prior to getting there about what we're going to buy or what we should buy. And then, those, as I always like to, say, grocery stores are in the business of making money. They're not in the business of making sure that you eat right. So their margins are really thin. It's just the way the food industry is set up. They don't make a whole lot of money on any one product. But when they do have opportunities to make money on product, they're going to put them in a prominent place. And most of the time, almost all the time, the biggest margins come from the food that is cheaply made and therefore doesn't have the greatest amount of nutritional value to it. So the prepackaged, the stuff that can stay on the shelf forever, those are the types of foods that a grocery store is going to make the most amount of money on. And so those then get put on the end caps. They get put in a prominent place for you. So when you walk in, you're guided, and quite literally guided towards certain places within the store. And I always like to tell the story. If you go into a grocery store, they all have cameras up top, and those aren't the primary purpose of those cameras. Is not to pick up shoplifters. The primary purpose is to track the flow of people moving throughout the store and to know how the flow works. And so then they can strategically place food and different products in different places so that it has the high traffic areas. And of course, we all know, hopefully we know that if we stay around the perimeter of the grocery store, that's largely where the food that's going to be the healthiest for us will be, for the most part. And that in the inner aisles is less, more prepackaged and so forth. Doesn't mean that you can't be successful eating in the inner aisles, for sure. And my point in this is to say, if you're not aware when you're going to the grocery store of how the whole process is set up, and that there is a strategy to it, it's really hard to be successful if you don't have your own strategy going in. And so this is something that we still do quite a bit of, is teach within our lifestyle medicine program. We help our Creighton employees that are in the program know how to navigate a grocery store successfully and what the strategies are and what the pitfalls are, and to have these a short list of strategies when you're going in. This is how you can be most successful, because we all know if you go to the grocery store and you're hungry going to the grocery store, you've already thrown a few things in the cart that probably don't necessarily need to be there from a health standpoint. We always, my wife Nancy and I always say, when our kids were little anyway, the worst thing that you could say in a day's time is when everybody gets home from work and school and the question comes up, what's for dinner? That is like the for our house. I mean, I know there's probably other things that were worse, but that was the ongoing thing. If we didn't have a plan, as managing this household of young and growing kids, and we got to the point where we didn't plan ahead and it was what's for dinner and everybody's standing there in the kitchen ready to eat and there wasn't anything ready to eat, that the choices were going to be not the healthiest at the point. So this is a lot about understanding the system, making a plan to be able to navigate the system. And so I should also say, too, that part of our work, hopefully, is advocacy work. It's not something we really talk about a whole lot in this program. It's certainly something that is part of Creighton mission, and maybe we should, put something else in this program relative to advocacy, and that part of our role as an educated person is to try to influence industry and systems so that we do move in a direction that is a bit healthier for food choices, for instance, or making physical activity an easier choice. If you think about, and I have a wonderful presentation that I show to our undergraduates in a course that's called Determinants of Health, but it tracks how our food system started, a couple hundred years ago and really formalized, we're in 2023, the formal food system as we know it now is not that old in the U.S., and it's only probably 100-ish years old. But we have evidence of changing the way foods were grown a little more than 100 years ago anyway. But the influence on the food system is something that is a more recent development. So if you go back 300-400 years ago, there weren't really any choices to eat. And so you now compare that to now, and even comparing the number of products in a grocery store today versus 50 years ago is dramatically different. And most of the food choices that we have are there because we demand them as a society. Those being that have a long shelf life, are easy to eat, they're convenient. That's what we have demanded. And so the food producers, they're in it to make money, right? I mean, this is a capitalistic endeavor that we have here in this country. And so whatever people are going to buy is what they're going to make, not necessarily what is good for you, but what you will buy. That is the ultimate endpoint. And so since our lifestyle is so quick paced, we're not at home very much. We demand convenience. And so the food producers say, we will give you convenience because that's what you're going to buy in the store. And unfortunately, that comes at a cost from a health side. And so, knowing this information from this high level social determinists, absolutely dead center conversation for social determinant of health, that being an advocate and making the default choice a healthier choice is something that we should all hopefully be working towards and striving towards. And if we can't do it at this higher level, which is totally fine, there's only, you can influence your politicians as much as you can and be an advocate for changes within your community, but you can certainly have that influence when you work with patients and clients. If nothing else from an education side. And I say, okay, so if that is challenging, which is absolutely challenging in that environment, just working one-on-one with individuals, you do have some control over what comes in your house. So we always said, okay, we don't have a whole lot of control in life, but we can at least control what we as parents bring into the house and have that as some sort of environmental control and have that as our own institution that we can have some control over and influence over. And that has then, as you might guess, also an influence as your kids learn to eat healthy, then that influences them and how they progress through life. So if nothing else, you at least you've got that. And if you don't have that, then you've got yourself, right? So there's just leading by example from yourself is a thing too. So I know this space is super challenging because it's overwhelming to think I don't have any influence over government or over the sugar industry, for instance. But you always can roll that back to something that you can have an influence on, and that is at least your own personal choice, mostly to some degree. Okay, so one of the things too, just I know we're coming up a little bit on time here, but I reached out to some of my colleagues at CHI to see what they're doing to screen for social determinants of health. And I thought it was important to share. I think this is something we need to probably work into our program more. And on the cases that we do, I'm starting to think we need to modify those cases to work in some other social determinant factors rather than just sticking only with really the lifestyle factors, is where those are lifestyle medicine cases. But those should probably be broadened out to include some other more socially determinant factors that can help us get a perspective when we're working with patients and clients on how we should be working with them to move them along in the best way possible for them. So CHI sent me what they do for their social determinants as a list of how they document in their Epic system, in their electronic medical record system. And so they use a social determinant wheel that has 12 components to it. And so it looks sort of like a clock, but I'll just sort of go through these and maybe read a couple of questions. But it is on substance use, so alcohol, tobacco, and then finances, anxiety, depression, stress, food insecurity, transportation, physical activity. It would be domestic violence or abuse. And then the last one is on social connectedness. So their questionnaires go through and ask about a question about finance, stress, and this is really their information taken from several other social determinant evidence-based questionnaires. They ask about physical activity, food insecurity, transportation, intimate partner violence. So there's 4 questions on that. Social connections. There's 1, 2, 3, 4, 5, 6 questions about social connection. So they have about 20 questions or so that they review with patients on a regular basis to make sure that they're able to address or at least identify factors that should be talked about at the same time, with their family physician at the same time as they're talking about other chronic diseases and ailments. So I think we're making some great progress forward relative to that. I think that's great news from a healthcare standpoint, that there's more information related to this. And that same document that I mentioned last week on CMS reimbursing health coaching on a temporary basis on the same paragraph also indicated that social determinants of health assessments would be reimbursed on a permanent basis. So that's something that they had, it sounds like they had tested and are ready to put that into permanent reimbursement there. So that's really good news, that our broadening of what health means is expanding, and not just saying, well, take your medications, make sure that you do my advice, and as your healthcare provider, and then come back and see me. That we're starting to understand and appreciate and now reimburse for this broader perspective of health. And so this is where I feel like we, as integrative health and wellness professionals, health coaches, have an opportunity to have a great influence on this. I think this is a really important role that we can fill on both sides of this, of getting reimbursed health coaching and social determinants of health. So certainly more to come on both of those, what that looks like as far as getting reimbursed for it, how you actually do it, particularly on social determinant side, what you do with the information. CHI has a network. If you identify that, that there's a social determinant piece, like maybe it's domestic violence, you have a network of referral. You say, okay, this is what's been identified. Here's the next step. If it's transportation, this is what it is. If it's food insecurity, this is what it is. So there's a large bank of community resources where folks can be referred to. All of this doesn't have to be managed by the healthcare system. This is where partners come in from the community, and the CHI uses a electronic system to be able to do this, to be able to refer people, and to first give the assessment, but then if this comes up, then this is where the flow of next steps should go for that particular patient. So all of that is to say we're making progress. All of it is to say we're still in progress, for sure, and it'll take it'll take some time for us to keep smoothing that out. But I think that is also opportunity for all of us to be able to have an impact. This is what integrative health and wellness means at its core, is to integrate conventional medicine with complementary medicine, and social determinants in all of those factors would certainly be considered something important to do alongside of our conventional healthcare system. So hopefully all of that is starting to make sense and tie together as far as why this is important for us to do within this program. All right, so looking forward again to seeing your discussions, watching your videos. It's always great to see your faces on those, to hear your voices too. And just as a reminder, we've got a Zoom session this week too, so I'm looking forward to seeing you there if you can make it. All right, everyone, have a good one.